All right. Well, welcome everybody to the fourth session of our seventh annual Women's Heart Symposium at UNC. For those of you who've been to previous sessions, welcome back. And for those that are just joining us, welcome to this one. This is going to be an exciting session about exercise and diet and nutrition. And we have wonderful speakers with us. Just a couple of things to start with. If you have signed on for this symposium, you will get your t-shirt for the seventh annual Women's Heart Symposium and a flash drive with all of our lectures on it, or all the slides on it. You'll also be able to ask questions through the question and answer or the chat box on the bottom of the Zoom screen. So make sure you put your questions in there. We're going to start out with Judy Hinderleiter, who is not actually with us. She pre-recorded hers. Her youngest son, Eric, is getting married tomorrow, so she couldn't join us. And then we'll have Gabrielle Brennan and Mary Hale, who are both work at the Wellness Center with me. Mary and I've known each other since 2005 and have done everything from cardiac rehab to personal training together. And Gabby is one of our exercise specialists at cardiac rehab, who is a great part of our team. So I'm going to turn it over to Allison, who will be showing Judy's video.
Hi, my name is Judy Hinderleiter. I'm the dietitian for the UNC Cardiac Rehab Program. Today I want to talk about nutrition and heart health. What about weight loss? Carrying extra weight is a large health problem. Only 1/3 of the U.S. adults are not overweight or obese. Unfortunately, this raises our risk for heart disease, stroke, sleep apnea, certain cancers, psychological disorders, and even death. If you look on weight loss diet on Google, there are 74 million results. So what are some of the things that you've tried to do to lose weight? There are different things that will work for different people. But we have yet to find a diet that's high in sugar, high in saturated fat, and high in salt that is heart healthy and produces weight loss. So once again, trying to get people to eat a lot of fruits and vegetables, whole grain, nuts, seeds, beans, fish. Usually it's a combination of diet and exercise that works with promoting weight loss and maintaining weight loss. Sometimes people will specifically restrict some foods like a dessert or alcohol, looking at where they get a good portion of their calories and cutting that in half. Some will use liquid diets. Some will use frozen dinners. Some will do intermediate fasting where they only eat so many hours of the day, or there's some days that they go lower in calories. The big thing is you've got to figure out if one of those is something that works for you that you will incorporate for the rest of your life. It makes no sense to go on some crazy diet that's really hard to do for so many months, lose weight, and then go back eating the way you were and have that weight come back. If obesity is so detrimental to our health, does losing weight reverse or at least decrease our risk for disease? The evidence does corroborate clear benefit. You don't have to be a skinny mini or get back to your high school weight. Just losing 5 to 10% of your weight can have a huge impact on your health. So, great improvements in blood glucose, triglycerides, blood pressure, LDL cholesterol, increases HDL, and also people just feel better. They're able to move around better. It's a lot of work to carry extra weight. And look at this one. If you lose 5 to 7% of your weight, it decreases the risk of diabetes by 58%. It was a 20-year study done at Harvard um, on changes in diet and lifestyle and long-term weight gain in women and men. It was reported in the New England Journal of Medicine in 2011. They found that um, folks would gain um, up to 16 pounds in 20 years, and they linked some different foods with weight gain, some different foods with weight loss. They also said that exercise, sleep, TV, and alcohol played a role. And let's look at the results of this study. Some of the food items and lifestyle habits that promoted weight gain were having potato chips. For each increased daily serving, there was a 1.69 pound gain in weight every 4 years. Having potatoes, having sugar sweetened beverages, um, unprocessed red meats, processed red meats, refined grains, watching TV, less than 6 hours of sleep, or over 8 hours of sleep. These all promoted weight gain. So, weight loss, having yogurt, having nuts, having fruit, having whole grains, having vegetables, and being physically active. All of those were beneficial in producing weight loss. One health habit that often gets overlooked is sleep. Research has found that we do better if we get around 7 to 8 hours of sleep per night. If folks don't get somewhere in that range, they end up eating about 22% more calories. There's an increase in ghrelin and a decrease in leptin. These are hunger and satiety hormones, and this can lower your metabolism. So, once again, look at your sleep habits and how well you're sleeping at night. That's where some moderate exercise, moving around, often helps promote sleep. The other thing is not having a huge meal and going to bed. That promotes sleep, having a smaller meal. Also, watching out for alcohol intake. Alcohol may put you to sleep, but it's not a quality sleep. As I mentioned, alcohol does not promote a quality sleep. And so be careful how much alcohol you have. The other thing is, alcohol is an appetite stimulant. It makes you want to eat more. So once again, be careful the amount of alcohol that you take in. Um, Encourage, once again, women to have 1 drink per day or less, and men no more than 2 drinks a day. And drinking more than 3 drinks a day actually has a detrimental effect on the heart muscle. These are some lifestyle habits that can affect your metabolism. So, things that lower metabolism are inactivity, just sitting around watching TV, muscle loss, skipping meals, delaying meals, extreme calorie restriction, and not getting enough sleep. So, those are the things that we want to try to do less of. What we want to do is raise our metabolism. So that makes it so we burn calories. We want to be physically active, doing chores around the house besides regular physical activity to get your heart rate in a certain range is beneficial. Building some muscle. Muscle burns more calories than fat. So, becoming more muscular, limiting time that you just sit as much as you can, stand, move around, eating breakfast, lunch, and dinner on time, having snacks. Once again, kind of just keeps that engine burning. If you're sick, your metabolism goes up. And there's some studies that have said that green tea extract helps. So think about what you might be able to do to increase your metabolism as well.
The cardioprotective diet is basically the Mediterranean diet. This is a heart-healthy diet. This is what folks are encouraged to eat. The first one is 4 to 5 servings of vegetables a day. A serving is a half a cup, trying to get people to do fresh frozen or, if it's canned, unsalted. The next one is fruit, 4 to 5 servings a day. A serving of fruit is the size of a tennis ball. Once again, fresh or frozen is great. I encourage people to limit fruit juice because you don't fill up as much. The next is whole grains, trying to get people to choose mainly whole grain products. The fiber takes longer to be broken down and you'll be feeling full longer. The next one is low-fat dairy. This is a great source of protein. So yogurt is one that I really encourage. Greek yogurt plain with your own fruit added is best. If not, if you can get some of the light yogurts that have less sugar or no sugar added. The next is fatty fish, trying to get folks to have 2 servings a week. A serving is basically a deck of cards, a little bit bigger. The other thing is eggs are a great source of protein, and they are actually good for us for vitamin D. If you want to be the most heart healthy and actually try to lose weight, having some beans and lentils almost daily. In fact, the true anti-inflammatory diet says to have a half a cup to a cup a day of beans, unsalted, or you cook from scratch without salt. Nuts are perfect food. Heart Association encourages you to have a handful a day. Vegetable oils, they encourage olive oil, canola oil, safflower oil, avocado oil. They prefer that over butter or margarine. The biggest thing is to limit sugar-added beverages and processed red meats. Besides following a cardioprotective diet, the next 2 slides have tips that folks have found helpful in losing weight or maintaining a weight loss. The most important one, I think, is to eat breakfast. Get some protein in early in the morning. Eat every 3 to 4 hours. Don't get overly hungry. Have protein every time you eat. Include that in snacks. So have an apple and some nuts. Eat so that you're eating slowly and you're enjoying your food. You don't have to be perfect. Eat healthy 80 to 90% of the time. Eat until you're 80% full. I don't want you to feel stuffed. Feel like you could have another bite, but you'll walk away. Limit alcohol. We've talked about that. Consider having 1 luxury food per day or 7 per week. A luxury food is 150 to 200 calories. That's like a 4-ounce glass of wine, a small half cup of ice cream, something like that. I encourage people to increase their water or no-calorie fluid intake to at least 64 ounces a day. A more accurate measure would be to take your weight in pounds divided by 2. That's how many ounces that your body needs per day. So if you weighed 200 pounds divided by 2, that's 100 ounces per day. And once again, if you're on a fluid restriction, you need to follow what that requirement is. The other one is drink 1 to 2 cups of water at the start of meals or snacks to help fill you up so that you'll eat less. They call it the cheapest diet trick in the world. Make changes in your lifestyle and your food and exercise that you'll do the rest of your life. Safe weight loss is 1% of your body weight. Consider using MyFitnessPal or Lose It to track your food and activity level. And once again, we've talked about sleep. I hope you enjoy this cartoon. Eat less and exercise more. That's the most ridiculous fad diet I've heard of yet. Once again, I'm hoping that you'll think about ways to eat a little bit less, eat a little bit healthier, more fruits and vegetables, move a little bit more, and doing that for the rest of your life to promote a healthy lifestyle. I'm sorry that I wasn't able to be present for this conference today. I am more than happy to answer questions. You can email me those or call me next week. I have a son getting married, and that's keeping me busy this weekend. Thank you so much.
Thanks, Judy, even though she's not here. I've got to get rid of this chat in front of me. So Gabby and Mary are here, and just going to start out by asking you guys how, I guess one at a time, not together, how you guys have done during the last year of the pandemic, and do you think how has it impacted what you do? You want to go first, Gabby?
Sure. Yeah, so with cardiac rehab, actually I was able to get to experience a little bit more of the hospital atmosphere, because we actually were unfortunately closed last March through June. So myself and a couple of my colleagues, we went out to the main hospital and we got to learn a couple of different areas to work in. So I worked in nutrition, so I was delivering food to patients in the hospital. And also I got trained as a pharmacy technician. So I was working at the Hillsborough Hospital, delivering drugs to the different floors of the hospital. So it was neat because I got to kind of experience and see what other people that work alongside of me do and kind of what their lives look like on a daily basis. But I'm really great and thankful to be back in cardiac rehab and getting to see everyone and exercise with everyone.
That's great, Gabby. And Mary?
Actually, I've been training since we closed. Just took the skills and the available equipment I had at my disposal and gathered up the clients that wanted to continue, and we exercised outside, we exercised in people's homes, we socially distanced and masked up, and did a lot of virtual sessions so that everybody could stay active. And in the beginning, I'm an epidemiologist as well, so I was able to work with a group of other professionals at the hospital to create a program that was going to deal more with the worried well, the people that were calling the hotline at the hospital with a million questions, but who weren't sick. And that took a good 8 weeks to put together, and ultimately did not wind up launching, but it was an incredible opportunity to present things like that to the higher ups and put together a public health program that would have been very successful.
Well, thanks. And I look forward to hearing both of your presentations. So Gabby, you want to get started?
Sure. All right. So, as you all may know, I'm Gabrielle Brennan, and I'm a clinical exercise physiologist here with the UNC Cardiac Rehab Program. And I would like to thank Paula as well as everybody else that's involved with organizing this great event with the Women's Heart Symposium today. So today we're going to be talking about a little bit of home-based cardiac exercise. So you can move to the next slide. So our objectives today are just going to be to discuss what the American College of Sports Medicine recommends for our exercise guidelines. And then we're going to try to learn how to create a safe exercise routine at home. So you can go to the next slide. So the American College of Sports Medicine's exercise guidelines are as follows. There's 3 different areas that they would like you to focus on for your training. So that would be aerobic, resistance, and flexibility. So ideally, they'd like for the average healthy adult to get 150 minutes per week of moderate intensity activity, or 75 minutes per week of vigorous intensity activity, or you could do a combination of both. And we'll talk a little bit further through this about how do I know if I'm in moderate or vigorous intensity activity. Moving forward, we're going to look at resistance training, so 2 to 3 days per week using all major muscle groups. And then flexibility, they also recommend at least 2 to 3 days per week. And they really would like you to do that daily, and before and after exercising, they say is going to be the most effective. So this is going to be our poll question. So Allison's putting up a poll for us. So during the past month, other than your regular job, did you participate in any other physical activities or exercise, such as running or calisthenics or golf, gardening, walking for exercise? So we'll just give you a couple of minutes there to get some responses coming in. I'm liking them so far.
Looks like an exercising group.
Yes, I love it. Look at all those exercisers. Awesome job. Very good. So it looks like we have about 86% of the people that are watching today are exercisers. That is awesome. And thank you to those who are honest. That's still a big thing too. So we'll move on to the next slide. So I asked this question because the Centers for Disease Control actually did this study and looked at the population in North Carolina as well from 2018. And they asked the same question to adults that were 18 years of age and older. And as you can see from the graph here, they factored out males versus females. So females are going to be in the red. And this response was looking at people who did not engage in physical activity. So as you can see, about 30% of North Carolina still is not physically active outside of their job. But the silver lining with that is that there still are 70% of the people that are, which is excellent. So moving forward to the next slide then, you'll be able to see a line graph that kind of shows you over the period of time. This is going to, we're just going to focus on the 2019 numbers, and the women are going to be in red again. So out of the 70% of women that are physically active in North Carolina, the number of people that are meeting the physical activity guidelines of doing both aerobic and strength training is only, as you can see by that graph, about 20%. So we still are losing out on 50% of those active people still aren't meeting those guidelines. So I'm here today to kind of answer any questions that you might have, and then we're going to talk a little bit more as we go through the next couple of slides about an exercise program and what you can do. So if you'd like to work out today, I don't have that much time, so you're welcome to gather some things. These would be some typical things that you'd like to use or have while you're exercising is some comfortable clothes or shoes. Water is always good. Be in a safe exercise space where if you would stumble or fall that you're not going to hurt yourself. You can have a chair nearby for balance, dumbbells, resistance tubing, get creative with some soup cans or water bottles. So those are some things that you can have on hand. And you're welcome to try the exercises that you'll see kind of on your own and get back to us with any questions. So looking forward, this is the components of a traditional exercise session. So we're going to always start off with a warm-up, and then we're going to move on to aerobic, we're going to move on to the conditioning phase, which consists of aerobic conditioning, muscular fitness, and neuromuscular training. And then we move into the cool down or the stretching phase. So we're going to be talking about a little bit more of these in detail in the next following slides. But first, we're going to look at intensity. So I mentioned, we want that moderate or vigorous intensity aerobic exercise, but what really is that? So this little handy scale, which some of you might be familiar with, is called the Rating of Perceived Exertion Scale. And this is going to look at exercise, and you can just rate it. So on numbers, like you can see the level, or how you feel. So you can choose to look at the colors or the smiley faces, the numbers, or the words to kind of describe how you're feeling while you're exercising. So if you click through the first one, the first one's going to be our warm up or our cool down. So ideally, we don't want to work too hard there. So, you're hardly working. It's a light effort. You can talk easily. And then moving on to your moderate intensity exercise, we've got that 5 to 6 level on the RPE scale. So you feel a little bit more breathless or maybe a little bit tired. And then moving forward, we're gonna, if you choose to do vigorous intensity exercise, that's gonna be more in that 7 or 8 category, so that you're pretty hard, working pretty hard, or you can't really talk easily. So I like to tell people, you know, a nice fast-paced walk would probably be your 5 or 6. If you're running and you really can't carry on a conversation, that's gonna be more of your vigorous intensity exercise. So moving on to the next slide, another way that you can also monitor your exercise intensity is through heart rate. Now, if you are on some type of like a beta blocker drug, that the RPE scale is going to be better to judge your intensity. But looking at heart rate, nowadays they have the fancy heart rate monitors that come on like an Apple Watch or a Fitbit, that you can look at your watch and get somewhat of a reading of what your heart rate is at that general point in time. But if you're not fancy, you've got 2 fingers, you can feel for a pulse. So you can feel on your wrist or on your neck for a pulse, and kind of calculate that based on how many minutes you're going to take it for, and figure out what roughly your heart rate is. And based off of that, then you can look at your target heart rate range. So you can get a maximal heart rate, and then moderate intensity is going to actually be 40 to 60% of your maximal heart rate. Vigorous intensity is going to be 60 to 85% of your maximal heart rate. So let's jump into actually doing a workout now. So the components of an exercise session, starting off with a warm-up. So we want at least 5 to 10 minutes of light to moderate intensity cardiorespiratory or muscular endurance activities. So moving forward for the next slide, then we're going to talk a little bit more about a warm-up. So you can go ahead and next slide. Yep. So this allows your body, so the reason we do a warm-up is it allows your body to generally increase in your heart rate, blood pressure, joint range of motion, and just allows you to kind of get mentally prepared for that workout that you're about to do. So 5 to 10 minutes here, and then we're going to move forward onto aerobic conditioning. So aerobic conditioning, we want at least 30 minutes of moderate intensity exercise, and that would be at least 5 days a week. So that's another way to look at that ACSM guideline. So if we move forward, the reason we do aerobic conditioning, this is going to be something that's going to require our continuous motion of our large muscles, and this is going to allow oxygen-rich blood to be pumped through all of those working muscles. So like I mentioned, about a half hour of exercise. And so these next couple of slides, I'm not going to go through them in detail just for time's sake, but I have some things that you would find in the gym, and then kind of some ways or how we would navigate how to do some of these things at home. So if you would be a person that would typically go to the gym and do like Stairmaster, then you might want to, you know, find a set of stairs at home and you could walk up your stairs at home, or find a set of stairs outside if you like to exercise outside. Looking at another piece of aerobic equipment like an elliptical, or maybe seated down like a new step. So, you know, you could do some things at home, going for a walk or walking with some walking poles, or if you're a runner, you could go for a run. So different things like that that are going to simulate the similar activity at home versus what you would do at the gym. So moving forward, then we're going to look at muscular fitness. So that's going to be exercise that they would like you to do at least 2 days a week, using all major muscle groups with 2 to 4 sets of 10 to 15 reps. So looking at muscular fitness, I have a diagram over to the side here that's going to show us a model of a female that's looking at her muscular anatomy. So our 6 major muscle groups are going to be numbered. So 1 is going to be corresponding to your chest muscles, 2 with your shoulders, 3 upper and lower back, abdomen is number 4, 5 is hips, and 6 is going to be legs. So these are going to be exercises that we're going to want to get a general well-rounded workout with. And the goal of muscular fitness is to make our activities of daily living a little less stressful physiologically, and to manage, attenuate, and prevent chronic disease. So then the following slides that are going to be shown then are going to be some different things that you can do for resistance training. So this slide, for example, is looking at a piece of gym equipment that you would use for your chest. And it's showing you a couple of different exercises here that you could do at home if you had a band, or if you had dumbbells, or if you just were doing body weight. So then moving forward, then we've got exercises that you could do doing your shoulders in the gym versus some things that you could do at home. And then moving forward, it'll take us through some resistance training with the upper and lower back that you would see at the gym versus some, dumbbells or some bands that you could, again, perform at home. And then for our abdomen, or what people like to call core muscles, we've got the gym piece of equipment and then some seated exercises you could do on the chair or on the floor. And then for our hips, we've got, again, a gym piece of equipment, and then there's a band exercise or like maybe a floor exercise that you could choose to do there. And then for our legs, there's a leg press machine on the left-hand side, and then there's a couple of different exercises that you can do at home using a chair. So then we're going to move a little bit forward to the neuromuscular training section. And I'm not going to talk a lot about this because Mary's going to do an excellent job after me talking more on this topic. But the American College of Sports Medicine would just like you to do an average of at least 2 days a week of this. And they also call neuromuscular training functional training. So this is going to involve the motor skills that would include balance, coordination, gait, agility, and proprioceptive training. So Mary's going to talk a lot more about that in her presentation. So to finish the exercise, then we've got our cool down or our stretching. So holding stretches at least 15 seconds and repeating about 2 to 4 times. So the reason that we do flexibility exercises is to improve our range of motion. And this is going to be most effective when muscles are actually warm. So after you did a workout. And the reason that we do a cool down, so we want at least a 5-minute cool down, maybe 10-minute cool down at the end of our workout. And that's going to allow your body to gradually decrease in your heart rate and blood pressure so that you come back down to normal. So that is my quick and dirty way of explaining the components of an exercise session. So we went through the warm up, the conditioning phase, and then the cool down and the stretching phase. So I thank everyone for their attention, and I will be more than happy to entertain questions at the end.
Well, I guess that brings it to me.
That brings it to you.
All right. All right. Well, while we're waiting for those slides to get up, I'm Mary Hale. I'm also an exercise physiologist and certified personal trainer at UNC Wellness Center. I'm here 16 years, but I've been doing this for 22. So this stuff comes very naturally. Let's start with this poll question. Have you developed balance issues within the last year? As some of our clients have started to come back now that we're seeing people get vaccinated and returning to the gym, balance has been almost the #1 comment that I'm getting from quite a few people. Let's see. So it looks like, I mean, so far, some people say no, about 50% of you are at no, but then we do definitely have some yeses. Give it a couple more seconds here. Okay, so, hey, thankfully, those that are at least with us today did not develop balance issues, but we have a close enough number, about 44% of you that did develop some balance issues. So let's go ahead and talk a little bit more about this neuromuscular training that Gabby was just talking about as well. So first off, let's just kind of define what the components of balance are. Number one, there's the equilibrium or the inner ear component, which is considered part of your autonomic nervous system. In other words, we don't have any control over that. That's the part of the nervous system that controls things like blinking and your heart rate. We cannot consciously control that. That does change over time. It changes as we age. But the last three are things that we can definitely do things about. The second one being strength, which is really just muscle mass versus atrophy. So if you're active and you have muscle mass, you can generally respond to things quicker. You are stronger. God forbid there is a fall. You're less likely to break something or injure yourself. And atrophy comes from underuse. Then we have agility, which is really the ability to move quickly and easily or respond quickly to a change in your environment. So if you feel yourself starting to fall or you trip on something, being able to get that leg out in front of you and catch it before it happens. And then there's the proprioception part, which is really the ability of the body to recognize and orient itself to its surroundings, or like in simple terms, where our bodies are in relation to other things in space and having the awareness of that. So let's go to the next slide. So what does the term neuromuscular mean? Well, I mean, in layman's terms, it's basically the junction between where a nerve that splits off from the spinal cord joins the muscle or the tendon so that the brain and the muscle communicate with one another. This particular junction is the interface basically between your brain telling your muscle to do something and the muscle being able to do it. And here we're talking about skeletal muscles. So, you know, in this case, if I want to raise my arm up, my brain had a direct connection to the muscles that are responsible for that through that neuromuscular junction, and we were able to make it happen. Let's go to the next one. So proprioception, again, is kind of the awareness of where your body is in space and how your body's moving in space. And we rely on quite a few things to get that information. Number one, your brain, but through your eyes and your ears, and most of our senses give us an awareness of where we are, especially if you have the ability to see. And then we have these vestibular organs, of course, in our ear. That's part of that autonomic nervous system. The eustachian tubes in the ears have fluid in them, and they act as sort of a level. But then we have these stretch receptors called Golgi tendon organs that are in our muscles, they're in our bones, they are in our tendons. And based on the level of, or the amount of pressure put on the bones and the amount of stretch or force put on muscles, our brain interprets all of that information and can kind of tell us where we are in relation to other things. A perfect example would be, you know, if you're walking on pavement outside, you have an awareness that that pavement is hard. If the pavement was suddenly to end and you wound up in grass that was wet or muddy, our body has to make an adjustment to that environmental change, and our muscles react differently and our body has to react differently. We have to be much more aware of the stimulation has changed, and so we've got to be more aware of how to change our body and our movement within that. Okay, let's go to the next one. So what do we do to help with proprioception? Well, we have these patterns, we call them PNF patterns, or the proprioceptive neuromuscular facilitation. In other words, this technique really has been used to improve muscle elasticity and has shown to have a positive effect on both active range of motion and passive range of motion. So in other words, you being able to move your joints yourself, or like in physical therapy, somebody assisting you to move your joints. If any of you have had joint replacements, you're very familiar with the passive range of motion, where a therapist takes you through that. They're used to stimulate the neuromuscular system in an effort to excite those organs I was talking about, the Golgi tendon organs. They're those sensory organs in your muscles, your tendons, your bones, and your joints, in order to provide a desired movement. So let's go. Good, perfect. So here's an example of some of those PNF patterns. We have 3 planes of movement because we are a 3-dimensional object. And in order for a PNF pattern to be successful, we have to take a joint through range of motion in all three of those planes. So if you see the first diagram, that's the sagittal plane, which actually cuts the body into left and right halves. Movement in that plane to incorporate both halves is front and back movement. So walking is a perfect example of a sagittal plane movement. And then we've got transverse plane, which cuts the body into the top and bottom halves. So exercise in that transverse plane that would incorporate the top and bottom halves of the body is twisting motions. Golfers are very familiar with that, but yoga, Pilates, simply moving an object from your car to, or a grocery cart to the car, or things in the kitchen, twisting motion. And then we've got the frontal plane, which separates the body into the front and back halves. And movement in this plane that incorporates the front and back half of the body at the same time is lateral movement. So one of the sports that has gained probably the most popularity in the last decade is pickleball. And it's great for an older population. You play doubles, tennis doubles, anybody that has ever played basketball or takes group exercise, even water aerobics, incorporate a lot of the side-to-side movement. So how do these PNF patterns prevent falling? Well, the number one thing that I tell everybody, every one of my clients to remember, is that your body will never adapt past the stimulus that you give it. So if you are sitting down and have been sitting down for the last year, for the most part, that's the stimulation that you gave your body, and that's the sport essentially that you trained your body for. And so it kind of forgets some of the things that you did before. And if you're not constantly stimulating the brain and stimulating your muscles to develop memory on what you're doing, falling now becomes a bigger risk. So the PNF patterns actually increase your body's awareness of its position in space. The old adage, if you don't use it, you lose it, is very true. If you're only used to navigating a very small space, your house was already set up in a way that it wasn't a fall hazard, you're not having to navigate an environment where you were sort of preventing yourself from that issue. Your central nervous system reads the state of skeletal muscle contraction through those Golgi tendon organs. And we talked about that. That tells you where your body is in relation to other things in space. And then, of course, it increases the communication speed between your brain and muscles, thereby increasing your agility or your reaction time to changes in your environment. So let's go to the next one. So some sample exercises for sagittal plane. Marching. Walking is a fabulous sample exercise for sagittal plane. But if you couldn't get outside, or if you're already kind of a fall risk, or have joints that are waiting to be replaced or have been replaced, simply marching in place, standing up. Notice that woman is in a corner so that she has something to brace herself against if need be. And then we have the gentleman marching in the chair. That's bringing the legs out in front of you, which, if you remember again, in order for both halves of the body, the left and right half, to work, we've got to walk in that or move in that frontal plane or the sagittal plane. Let's go to the next one. So then we've got the transverse plane or the spinal rotation. If anybody was able to play golf through this pandemic, you've been working on that transverse plane. But if not, these twisting exercises, you can do it in a chair. Doing it in a chair is perfectly fine. In fact, you have to listen in one way. That's great, because you can only take your body so far. And you don't have momentum when you're sitting in a chair. You simply turn in it and your body tells you when you need to stop. Twisting rotation or twisting exercises when you're standing is a little bit different. Your spine is in its weight-bearing position. That is excellent for balance, because as you move, you're challenging your body in space. Just again, examples. And let's go to the next one. And then we have frontal plane. So again, remember, frontal plane exercises, they cut the body into front and back halves. So in order for us to get both of those working at the same time, we've got lateral movement. If you were playing pickleball or you were taking aerobics classes, we've had them live streaming from here for months. but there's a ton of stuff available online. Any of those lateral movements. Here you've got somebody standing and doing a lateral leg lift, and then we have the lying down lateral leg lift. That's moving in that particular plane of motion. Let's go to the next one. So here's the real kicker, since we're talking about cardiovascular disease. There are quite a few chronic diseases that actually affect our ability to interpret the information from our environment. And so we've got things like diabetes, stroke, congestive heart failure, osteoarthritis, peripheral neuropathy, which can occur with or without diabetes. It can occur with peripheral vascular disease. I threw multiple sclerosis in there and herniated discs because that is something that we see quite often. If the brain does not get the signal from the muscles because of damage to the nerves or damage to the spine, our brain does not interpret that information. So exercise actually helps to create new vasculature in the legs. We're not talking about new arteries necessarily, although that does happen, but new veins can grow, and it's constantly giving information back to the brain so that your body knows where it is. So these diseases affect the way our bodies process our surroundings, as they have the potential to damage or limit our nervous system's ability to read the messages the proprioceptors send. So I guess now we open it up to a number of questions.
Yeah, there's been a few that have come in. The most recent was, is riding a stationary bike considered a weight-bearing exercise? If you stand, and thanks Mary and Gabby, and just jump in on the answers. Is riding a stationary bike considered a weight-bearing exercise if you stand while biking? Asking if this is productive weight exercise for osteoporosis prevention.
Absolutely. Gabby, you want to chime in on that too? Yeah, you can stand while you bike. It most definitely is weight-bearing. It will have a positive effect on osteoporosis because the neck of the femur, especially the portion of your upper leg bone that is supporting that movement, is you're throwing new bone matrix down with any weight-bearing activity like that.
And there was a question that was, what does proprioception mean?
So complete layman's terms, just speaking to the general public, it's the way your muscles and your bones basically tell your brain where you are in space, just based on what you're standing on, what you're around, what you're able to touch.
And that's not with just exercise. That's everybody has proprioception of your environment, basically.
Right. And you wouldn't be able to navigate your environment, period, if we didn't have that ability. We wouldn't know, how do you know that there's a chair behind you necessarily when you're going to stand up and sit down? Probably because you just got out of it, and it's there, but having the trust and the muscle memory to know that if you sit back the same way that you got up, it's there. That's part of proprioception as well.
Gabby, how about this one? Will Tai Chi and yoga work for regular exercise?
So Tai Chi and yoga are good forms of balance exercises, and they do work a little bit on strength, but if you could get a little bit of more movement, like with aerobic exercise, like walking maybe, that would work a little bit better, but those are actually great forms of exercise.
Good. Hang on a second, my husband's blowing the leaves. Okay, what causes when you're walking, and either one of you guys, what causes when you're walking to sometimes miss your step, almost like your brain caused you to miss your step? I know, I'd like to know the answer to that one too.
I wish there was a clear-cut answer for that. A lot of times it's, how many other things are you doing at the same time? I've noticed that's a major thing. I had, no lie, 4 women all within the same kind of age group, 65 to 70 in 1 year, just looking at their phone, carrying a cup of coffee and trying to walk, and all 4 broken ankle, just stepping off of a curb, missing a step, something that you wouldn't even think was a big deal. So being mindful of where you're walking, what's the environment that you're walking in? Is it stable? If it's a sidewalk, pay attention. Are they even? Is there one of those blocks that's a little higher than the other that we need to pay attention to?
And sidewalks aren't always even pavement, even though they look like even pavement.
Exactly. Yeah.
With severe arthritis, one hip and one hip replacement, two knees, one hip and second hip replacement surgery in August. What exercises are acceptable for weight loss? I'll open to either one.
Gabby, you want to take it?
Well, usually with hip surgeries, they want to limit flexion of your hips after you have hip surgery. So I don't know if they're going to be doing physical therapy or not after their hip surgery, but that would probably be a good place to start as far as exercising, just to build back some of the strength in your hip. And then as far as maintaining exercise, once you get the strength back, then you could kind of move forward into either some low impact seated exercises or moving through some range of motion with some slowly weight bearing with maybe like a walker or somebody that's assisting, and then move forward into walking on your own.
If you're enough, I didn't catch how far out you are from the surgeries, but if you're post 1 year on hips, flexion and crossing the body, adduction, abduction shouldn't be really an issue. Knees are a little bit different. You really want to work on your flexion there. But, if the wounds are healed and you can get in the water, swimming with a kickboard is an awesome option. That is very low pressure. Doing a stationary bike or a recumbent bike, new step exercises, it's a great way to get yourself back in without having to worry about all of the impact of something like an elliptical or walking on the treadmill. Ease yourself in. Remember, those joint replacements take about a year to really cement.
And that sort of leads into our last question is, are water aerobics and swimming good for my heart?
Yes.
Good for everything. Stretching out that back.
Absolutely.
Resistance. Anything you can add, Mary? Or Gabby?
About the water aerobics?
Water aerobics or swimming?
That is one of the best cardiovascular exercises. And the water aerobics, the additional benefit to that is that it can be weight bearing. And for people who have got issues with, arthritic joints that either aren't ready to be replaced yet or have been, depending on how deep that water is, if it's up to your chest, 85% roughly of your body weight is absorbed in the water. So you can run in the water and you can hop in the water and still get the effect of that impact on the bones without having to absorb all of your weight.
I think that's
and so
great.
The water aerobics tries to incorporate all of those different planes of motion and use the resistance of the water. So
one more question just came in. Are chair exercises just as effective as regular exercises, or do you have to do more of them?
We got to consider our audience, for an older person, who really needs to do the chair exercises, because there's a lot of other factors. If they're a fall risk, or if there's already been a fall and we've had a hip break or wrist break, the mortality rate after that for most women, because their lifestyle changes so much, is about a year. So if they're willing to do the chair exercises and be as mobile as possible, oh my God, that's fantastic. Do it and pay attention to what your energy level is. Your body's going to tell you, if you're 75 or 85 years old, you don't need to be doing, these crazy exercise videos that are out there meant for 30-year-olds.
Yeah, I think you can get just as good at exercise in a chair.
Sure.
Without
You're still moving. That's good.
So, Brian, do we have time for just one more? And then that'll be the last one. I have a herniated lumbar disc and I'm afraid to bend too much at the waist. What type of exercise can I do to strengthen my ab muscles, since I've been told my abs are weak?
Plank, plank, plank.
Yeah.
So, and you can also do a simple one with just, if you're sitting in a chair and you take your belly button and you think of bringing your belly button in kind of towards your spine, that actually works really good with strengthening your transverse abdominis muscle around, kind of like a hula hoop that goes around your belly. And that will also work to strengthen some of your core muscles.
That'd be a good way, not that I'm trying to put a plug in for personal training or anything, but that would be a really good time to, especially if there's a herniated disc, get a professional who's very familiar with that problem and get somebody to write you an exercise program that is going to strengthen all of the back muscles around the herniated disc so that the entire unit of your spine is stronger so that we can prevent that from getting worse.
There was a comment that says that she's curious if people who are naturally genetically thin without a heart healthy diet or without a heart healthy diet and exercise regimen are much risk of heart disease. I'm reading that correctly. I'm curious if people who are naturally genetically thin without a heart healthy diet and exercise regimen, are they much risk of heart disease? Are they at risk of heart disease? I'd say everybody who doesn't follow a heart healthy diet and doesn't exercise has some risk of increased risk for heart disease.
Yeah.
Definitely from the exercise standpoint. Well, thank you guys so much. This was fun. I learned a lot. You can learn every time you listen to somebody. I've learned that everything is new. And Brian, I will turn it over to you.
Okay. Thank you, Dr. Miller. How are you doing, everyone? My name is Brian Frake. I'm Director of Development at UNC Health Foundation. I had the pleasure of working directly with Dr. Miller and the fantastic staff at UNC Cardiology. I want to echo our thanks to Mary and Gabby, and then also Judy, even though she's not here, for the great presentations. Just really informative, just really good stuff for our participants and our attendees. I did want to let y'all know that you'll be seeing slides right now. These are the email addresses, and you don't need to rush on writing all those down. We will be sending resources out to everyone who has signed up for today's presentations. So you should be receiving those early next week, along with all the presentations, the PowerPoints and the video, as well as the recording of this session. So those will all be coming to you, as well as the nice gifts from the Women's Heart program for attending this presentation, the t-shirts, as well as a nice flash drive with a lot of other great information on it. Before we wrap up today, just had a couple things I'd like to remind everyone. You will be receiving a very brief survey at the close of this Zoom meeting. We'd really appreciate it if you'd spend a minute or two just filling that out for us. It really gives us great information on this symposium, but also ideas for future ones. We've done over 75 so far this last year. And the more ideas we have, the better. We want to know what you want to know. Also, if you'd like to know more about how you can get involved and engage with the Women's Heart program and Dr. Miller in supporting efforts like this, this Women's Heart Health Symposium has expanded greatly because of private donations from supporters of the community who have really seen this as a great benefit to everyone, especially women, but the families and the community at large. And you can do so, learn more about that. If you'd like to talk to me, my email is listed, as well as my phone number. Would love to talk to you. And you just have a great day. Thank you so much for joining us. And Polly, you have any last words?
Yeah, just thanks everybody for coming to the symposium. There are 2 more sessions later today.
That's right.
All very interesting, and hope we'll see you there.
Yeah, you can sign up for them right now. So thanks a lot, and we'll see y'all soon. Have a great day.
Bye. See you.